Then the question is how often? How often do we check the anti-TPO? How often do we check the T3, T4, and TSH? Okay, that is actually a very important aspect that we need to discuss. What you need to understand is that anti-TPO is diagnosis. You're diagnosing the case, okay? But you need something to even monitor. Now, when you talk about monitoring the disease, monitoring a disease, monitoring the medication, that is your T3, T4, and TSH. Okay? So my very strong suggestion and request would be don't obsess over the anti-TPO. Okay? What you want to look at more closely is the T3, T4, and TSH. T4 and TSH being more under focus. Okay? So suppose you say, why am I saying not to obsess about anti-TPO? Is because anti-TPO has a mind of its own. So once it's high, it can kind of go up and down within that high range only. It can go up and down, and people do get happy, it's coming down, or they get upset if it's going up. But honestly, from a medically significant perspective, we don't worry about the up and down fluctuations at all. Okay. Why we don't worry about it? Because we look at the T3, T4, TSH when it comes to the medication. Okay. So I remember I had a patient, and she is one of the patients who falls in a category which we say is about less than 5% of the patients can go into something called as spontaneous remission. What that means is technically the anti-TPO became negative. You have two reports in front of you. Couple of years back, it was positive. Couple of years back, you did it negative. There are a couple of reasons for that. Let's not get into that. But it can happen, okay? But unfortunately for this patient, although the anti-TPO became negative, okay, the TSH didn't really come down as much as we would have liked it to come, So in that scenario, if the TSH doesn't come down, we can't reduce medication, although the anti-TPO has become negative, okay? So what is important is that even though the anti-TPO might increase a little bit, few points here and there, no problem. Even if the TSH is coming down, that's a good sign. Okay, TSH is coming down, T4 is going up. That's actually a good sign. Okay, so that is what we want to focus on instead of obsessing over the anti-TPO. Like I said, even if it goes up and down, I needed it for a diagnosis perspective, spontaneous remission perspective, that is okay. So let's say that you really want to find out about the anti-TPO, you do it once in a year, once in 2 years, once in 5 years, once in 10 years. For me, I might never ask a patient to repeat it, or I might ask a patient to repeat it in a year or two also. It depends on a case-to-case basis, okay? But I'm a little more specific about T3, T4, TSH. And constantly I'm saying T3, T4, TSH is because it's not only the TSH. You have to look at the T3 and the T4, okay? So when I say T3, T4, TSH, if you have any recent changes in therapy, any recent changes in lifestyle, any recent changes in medication, then I would actually suggest doing the test maybe even 6 weeks, 8 weeks also. This is the T3, T4, TSH I'm talking about. Or so that is about 2 months. You can monitor yourself in about 2, maybe 3 months also, okay? And suppose you say, my numbers are good, my medication is stable, I'm asymptomatic, my weight is okay, I'm actually doing pretty well. Even if you check it once in 6 months, once in 4 to 6 months, that's actually pretty good. So let's say anybody on medication or subclinical, not on medication, you have to be careful. So make sure you test your thyroid at least twice a year. So that is T3, T4, TSH, not the anti-TPO, okay? And in fact, if your anti-TPO comes negative the first time, forget about it. Please don't repeat. Okay.